Different schools start their students in clinic at different points of time. For some of you, this might be at the beginning of your third year. For others, it might be a little bit before then. Wherever you are in your dental school journey, the time has come to put your sim clinic practice and your knowledge to use and start treating patients. Welcome to clinic. Here are a few tips that will hopefully help you set more realistic expectations as to what your experience in clinic will be like over the next couple of years or however long you have left in dental school. Understand that you will be slow. Part of this will be due to you being nervous. Your hands will probably shake.
My hands are shaking! My hands are shaking!
It might be during your first injection or your first filling, but chances are it'll happen at least once or twice. The other reason you'll be slow is because working on patients is completely different than working on mannequins and drilling on plastic teeth. The patients you'll work with have fears, concerns, questions, quirks, and more importantly, tongues. Seriously, you say the word tongue while working on a patient, and sometimes it can be like... As you start in the clinic, now is the time to focus on doing the procedures correctly. Speed will come over time, but it's much more important that you learn to do the procedures right rather than focus on doing them fast. Not only will you be slow, but there will be times that clinic is slow. I know you have this big idea of what clinic will be like and treating patients day after day after day, but that isn't always the case. Some of you might be in charge of scheduling your own patients and managing your own schedule. Others of you will be at the mercy of whatever scheduling program or schedulers that your school employs. Every school is different, but just anticipate that there will be days that patients don't show up. Whenever this is the case, try and use this time wisely. You don't have to always pull out your laptop and go over PowerPoints or do some textbook reading or practice in the sim clinic. Those are some things that you can do with this time, but sometimes it's nice just to relax a little bit too. Even when you do have a patient in the clinic, things can be slow. Maybe you have a limited amount of x-ray rooms or panos, and you've got to sit around and wait for a little bit for one of those to become available. A lot of the time, it's just sitting around waiting for your attending faculty, whether it's for a start check, prep check, a final check, getting radiographs approved, getting codes completed, getting a SOAP note approved. There's a lot of waiting around for your attending faculty. And there's a bunch of you as students and only a few of them. So try and be patient and understanding, even though it can be annoying at times. After all, this is a school, it's a learning environment, and we are operating under their license. So try and be patient and respectful of your attending faculty. Speaking of your clinic faculty, your interactions with them have the potential to be some of the best learning experiences that you have while you're in dental school. Many of them have decades of experience behind them and are more than happy to share the things that they've learned so that you can learn from them and apply that into your future career as a dentist. Unfortunately, there are those faculty that I wonder why they were persuaded to work at a dental school. And I'm just speaking generally here. This is a broad statement about all dental schools and the faculty that they employ. But it seems that there are some faculty that enjoy making students feel foolish, looked down upon, or lesser than them. Your interactions with them can range anywhere from cold or condescending to downright cruel. From my own experience, I've been very fortunate to have almost entirely positive interactions with my clinic faculty, and I'm so grateful for that and for the things that I've learned from them. That's not to say that it's been perfect, but it's been much better than I'm sure some of the stories that you and I have both heard. Regardless of how your clinic faculty are, try and learn from them. Each of them are unique and have a different way of doing things. And you can take the things from each of them and apply them to your career so that you can have a better idea of the type of dentist that you want to be. Understand that you will have difficult patients. There are a lot of patients that are great to work with. They have little to no significant medical history, they talk just the right amount, they are very cooperative in the chair, and the appointments just go well. Other patients are the complete opposite of that. They have very extensive medical histories. They have the worst gag reflexes. They have large tongues, small mouths, can't open very wide, and have to sit up every couple of minutes. While this isn't the majority of patients, this happens more often than you might think. It is your responsibility as a student dentist and as a future dentist to do everything you can to help these patients have a positive experience in the dental chair so that they keep coming back and receive the treatment that they need. Just know that you aren't alone in having a difficult time treating certain patients. Another thing to anticipate is the fact that you will refer patients out. Maybe your school has specialty clinics and they'll be referred there, and you can see those patients in those clinics, or maybe your school doesn't have specialties and you will be referring these patients to outside specialists in private practice. There might be root canals or extractions that are too complicated for you to perform in the school's main clinic. Certain situations can be really heartbreaking, like when a parent brings their child in for their very first dental visit, and you look in their mouth and all you see is just rampant caries. And you have to tell them, I'm so sorry, there's nothing that we can do for your child today. Because of the extent of the work that they need, they have to go and see a pediatric dentist and will probably need to be put under general anesthesia in order to accomplish all of the work that they need done. Or having a patient come in with excruciating tooth pain only to turn them away and say, I'm sorry, this root canal would be too complicated for us to do here. Those aren't fun conversations to have, but it is something that you should expect at some point in your time in the dental clinic. The last and maybe the most important thing for you to anticipate is you will mess up. It might be something as small as completing the wrong code or seating the wrong patient, or it might be something a little bigger like drilling on the wrong tooth or anesthetizing the wrong area. Whatever the situation is, know that you aren't the first dental student to do this and you won't be the last. I know it can feel really overwhelming and you feel so foolish for whatever the mistake that you made, but understand that it's completely normal. Just treat this as a learning opportunity. You can either beat yourself up or you can learn from it. Share these experiences with your friends and your classmates, and hopefully they'll return the favor by sharing the mistakes that they make so that hopefully you can learn from their mistakes. One of the most severe ways that you can mess up is by hitting the nerve or the pulp of the tooth. I feel like this is kind of like getting into a car accident. It's not really a matter of if, but a matter of when. And when this does happen to you, know two things. One, it's happened before, and the second thing is there are things that we can do to help improve the prognosis of that tooth. So it's really not the end of the world, even though it might feel like it when it happens. With that, I wish you all the best of luck during your time in clinic. Work hard, make the most of it, and enjoy your time there.